Hello student, now we are going to discuss one topic, that is deep sea diving. So if you enter into the depth of ocean, what is going to happen in your body, particularly the respiratory system, right? So suppose first I am drawing the surface of the sea water. So this is the surface, okay? So sea surface. So we all know that at the surface of the sea, the normal barometric pressure is 760 millimeter of mercury. We all know this thing. Now, we have already understood in the previous chapter that if you ascend into the high altitude from the sea surface, then the total barometric pressure will be reducing gradually. If you enter into the depth of this ocean, what will happen? There will be increase in total pressure. Why? Because of this water column. It is said that if you enter a depth of 10 meter, right, or 33 feet, for every 33 feet or 10 meter depth of water means 1 atmospheric pressure will be increased. Means if I enter at a depth of 33 feet or 10 meter inside the sea water, total pressure at this level will be 1 atmospheric pressure due to the surface of the sea and 1 atmospheric pressure due to this water column. So the total will be 2 atmospheric pressure. Means if you enter in the depth of the ocean with this 33 feet depth, okay, the total pressure surrounding your body will be 2 atmospheric pressure, right? So if you are entering at a depth of 100 feet, right, so what is going to happen? How much pressure you are going to get on your body surface? So suppose this is the 100 feet depth, right? So 100 feet. So obvious thing is that for every 33 feet there is increase in 1 atmospheric pressure. So 33 means 99 feet means 3 atmospheric pressure and 1 atmospheric pressure on the surface of the sea water. So the total pressure that is going to be exerted on the body surface at a depth of 100 feet is 4 atmospheric pressure. So at a depth of 100 feet, if you are inside a submarine, right, suppose you are inside a submarine, so nothing is going to happen because this submarine is made up of strong steel material, and although the outside pressure is very high, and that is 4 atmospheric pressure, it is not going to affect your lung because you are sitting inside and inside pressure is maintained at 1 atmospheric pressure, right? So nothing is going to happen to your lung volumes, okay? But there is one condition where suppose one person is entering in the depth of the sea, and that is same depth, that is 100 feet depth, and that is known as apnea diving. Apnea diving, you know, that the person takes a long deep breath and then he jump inside the water. The person can enter even at the depth of 100 feet also. So suppose the person is here at a depth of 100 feet, right? Okay. So now the submarine is not there. So the outside pressure is 4 atmospheric pressure. What will happen to the lung volume of this person? There will be compression of the body surface, there will be compression of the thoracic cavity. So the lung volume will be compromised, the lung volume will be compressed. If the total lung capacity, suppose the total lung capacity of this person is 6 liter. When the person is entering at the depth of this 100 feet, what will happen to the lung volume? The lung volume will be 6 liter upon 4 atmospheric pressure, that is total lung volume will be only 1.5 liter. Means there will be compression of this lung, and because of the compression, because of the huge compression, that is the 4 atmospheric compression, what will happen? The lung volume will be compressed. Now whenever the lung volume is compressed, think of the Boyle's law, PV is equal to constant. If the volume is compressed, what will happen to the pressure of these gases inside the lung? Pressure will be very high. And if the total pressure of the gases is very high, what will happen to the partial pressure of oxygen gases here it will be increased. What will happen to the partial pressure of carbon dioxide gases inside the lung? There will be increase, and obviously there will be increase in partial pressure of nitrogen also. But when the person is staying at the depth of this 100 meters, suppose now the person is staying there at a depth of 100 feet for few seconds, maybe 30 seconds, maybe 40 seconds, the person is staying there. During the stay, what will happen? Because the person is utilizing more and more oxygen, the partial pressure of oxygen is going to reduce, and it will reduce to a very low level. And because the person is continuing producing this carbon dioxide, the partial pressure of carbon dioxide is gone rising. Simply, if you enter into the depth of the water, what will happen? You are holding your breath, you are not getting fresh oxygen, you are utilizing the oxygen and producing carbon dioxide. So hypoxia and hypercapnia both will be created inside your body. Now you all know that this hypoxia and hypercapnia, they are the very strong stimulus, very strong stimulus for your peripheral chemoreceptor. And what will happen? Ultimately your ventilatory center will be stimulated to a very strong level. Now whenever your ventilatory center is stimulated, the person will feel a very strong urge to take the breathing, to initiate the breathing once again. But whenever the person is inside the depth of the water, obviously he will not be able to take inspiration. So the person has to ascend to the surface of water rapidly, and he will be happy to take a deep breathing at the surface of the water. Otherwise what will happen? This oxygen will drop down to a very critical level, and the death of the person may also happen. So this way, when the person is entering in the depth of the water, now we came to know that there will be compression of the lung volume. So this is only we are discussing when the person is staying inside the water for few seconds or maybe for few minutes. But suppose I want to stay inside this depth, 100 feet depth for long duration. I want to stay there. I want to see what is there inside the depth of the ocean. I want to see corals at the level of ocean, right? So what will happen? You want to stay there for long duration. So I have to take some measure so that this compression of the lung volume is not happening, right? So again, take the same thing that the person has entered at a depth of 100 feet, right? 100 feet depth, So outside pressure is 4 atmospheric pressure. This 4 atmospheric pressure is trying to cause compression of this lung, but I will take some measure by which I will prevent this compression of the lung. How to prevent that? If you give equal amount of pressure through this mouth of the person, then what will happen? That pressure will counteract the outside pressure and the lung volume will not be compressed. Very simple. So how to do that? Obvious thing is that you have to use one breathing apparatus by which this tube will be connected at the mouth of this person, mouth of this person, right? So here is the mouth of this person, and the other end of the tube is connected inside a gas cylinder where very huge pressure is there inside this chamber. This pressure is approximately 150 atmospheric pressure. So obviously you are not going to deliver this 150 atmospheric pressure inside your lung will rupture. So I require one valve, I require one valve which will control this pressure according to your requirement. Whenever you are entering at a depth of 100 feet, outside pressure is 4 atmospheric pressure. So the pressure which you are going to inject here will also be 4 atmospheric. So this valve will regulate that whenever it is open, the 4 atmospheric pressure will deliver. But suppose the person want to enter into the more depth. So outside pressure will be more. Whenever the outside pressure is more, I have to increase this inside pressure also. Then the valve will deliver a different level of pressure, right? So this is the first valve which is controlling that how much pressure has to be delivered. And then there will be another valve at the level of this mouth. There will be another valve. This valve is known as the inspiratory expiratory valve. So whenever the person wants to take the inspiration, the valve will open up, and during expiration, the expiratory air will directly deliver outside. So all of you know the system that we are discussing here, this system is nothing but known as scuba, right? So all of you know that this scuba is the system. The full name of this scuba is self-contained underwater breathing apparatus, right? So you look at, this is the cylinder. Inside this cylinder, the pressure is very, very high, approximate 150 atmospheric pressure air is there, right? Rather than normal air, some different gas is also used. I will tell you that. But before that, you look at, this is the first valve which is controlling the pressure, and there is a demand valve, that is the second valve. Whenever the person is demanding the inspiratory air, the valve will open up and the person will breathe in, right? So this way scuba works, right? But the thing is that although you are using this scuba, but the pressure with which the gas is delivered inside this lung is very, very high. To counter the outside pressure, you are giving pressure which is equal to the outside pressure, and that pressure is higher than that of the normal atmospheric pressure. So whenever you are giving higher pressure gas, what happens? There will be again increase in partial pressure of all gases. Means at the level of this alveoli, if I calculate the partial pressure of the gases, that will be very, very high, because the delivery pressure is 4 atmospheric. So what is going to happen? The partial pressure of oxygen, okay, at the level of this lung will be very, very high. Partial pressure of carbon dioxide will also very, very high, and the partial pressure of nitrogen will also very, very high. And the person is using this scuba for long duration, so he is staying inside the depth of the sea for long duration. So if partial pressure of oxygen is very high for long duration, it can create some toxicity that is known as oxygen toxicity, okay, at the depth of water. So what will be the oxygen toxicity? You know that whenever oxygen is given at high pressure, there will be huge amount of dissolved oxygen in the blood. And dissolved oxygen, if the partial pressure of the dissolved oxygen is very, very high, you know that it will produce free radicals of oxygen. So I am writing here, oxygen free radicals will be created, will be generated, okay. Radicals will be generated inside the body. Now you know that free radicals, particularly the oxygen free radical like superoxide ions, right, the peroxide, they are, okay, very, very dangerous for the lipids of the cell membrane, particularly the polyunsaturated fatty acids. So there will be destruction or damaging of fatty tissue, okay, particularly the polyunsaturated fatty acid. Now you all know that whenever the free radicals are damaging the fatty tissues, the main organ that is going to be affected is the CNS, because you know the neurons are under the covering of the myelin, and myelin sheath is nothing but the plasma membrane. Plasma membrane contains huge amount of fatty acid. So this myelin is going to be damaged, because of which you know the main symptoms of the oxygen toxicity is related to CNS symptoms, like for example muscle twitching will be there may be dizziness, there may be lethargy, there may be coma, there may be seizures or convulsions. So this is due to high oxygen partial pressure, which is known as oxygen toxicity. So if you are using scuba for long duration, okay, even you can suffer from this kind of problem of oxygen toxicity. Remember that, okay? Now think of the carbon dioxide. If the partial pressure of carbon dioxide is very high, then carbon dioxide can also produce toxicity, and the carbon dioxide toxicity will be only seen when the partial pressure of carbon dioxide is beyond a certain level, and that you have to remember. So we know that partial pressure of carbon dioxide at the level of alveoli is 40. So from this 40 up to this 80 millimeter of mercury partial pressure of carbon dioxide, this is well tolerated by the body. So this is tolerable by the body. But whenever this partial pressure of carbon dioxide is going beyond this 80 millimeter of mercury, it is going to create toxicity inside your body. And what will be the toxicity? Now you note down, very peculiar. Carbon dioxide is a stimulus for our respiratory center. We have seen that. So whenever your partial pressure of carbon dioxide is rising from 40 to 80, there will be linear stimulation of the ventilation. There will be increase in ventilation more and more. But whenever your partial pressure of carbon dioxide is beyond 80 millimeter of mercury, rather than stimulation, carbon dioxide is going to depress your respiratory center. So there will be depression of respiratory center. Not only depression of the respiratory center, it can also create severe acidosis, it can also create weakness, lethargy, other symptoms, right? So this is all under the category of carbon dioxide toxicity. Now, rather than oxygen toxicity, rather than carbon dioxide toxicity, the dangerous one is the nitrogen toxicity. Why? Because if you look at the normal gas, normal atmospheric air, nitrogen is 79% and carbon dioxide is very less, and oxygen is also 21%. So which partial pressure will be maximum at the level of this alveoli when you are using the scuba? The nitrogen. So this high partial pressure of nitrogen is going to produce, obviously I am writing here, nitrogen toxicity, and that can be very severe. Why the nitrogen toxicity will be severe? Whenever the nitrogen partial pressure is high, again the same thing will happen, that there will be increase in the dissolved nitrogen. There will be increase in the dissolved nitrogen in the body. You know, the nitrogen can be dissolved inside your body water also. It can be dissolved in the fat also. Guyton is saying the nitrogen has mainly preference for the fatty tissue. So 60% of the total dissolved nitrogen will be dissolved inside the fat tissues, right? And 40% of the total dissolved nitrogen will remain in the water, body water part. So when this nitrogen is entering inside this fatty tissue in the form of dissolved nitrogen, it takes very long time. Means dissolve of nitrogen, okay, takes very long time, slow process, right? Similarly for water also, it takes a little bit more time. But whenever this dissolved nitrogen is becoming more and more inside the fatty tissue, again I can understand that this myelin sheath and the neurons are going to be affected more. Why? Because this dissolved nitrogen will alter the ionic conductance of neuronal membrane. Getting my point? Neuronal membrane. So all of you know that neuronal action potential is based on different ion channels, sodium, potassium, etc. Whenever the dissolved nitrogen is very high in the membranes of the neuron, what will happen? This dissolved nitrogen is going to damage this ionic conductance of this neuronal membrane, and because of the change of this ionic conductance, what is going to happen? There will be decrease in excitability. There will be decrease in excitability of the neuron, and because of this decrease in excitability of the neuron, various symptoms of nitrogen toxicity will be produced. All these symptoms of nitrogen toxicity is under the heading of nitrogen narcosis, under the heading of nitrogen narcosis. So basically all the symptoms which is happening due to this nitrogen toxicity is known as nitrogen narcosis. The symptoms will be similar to alcohol intoxication symptoms. So all of you know what will happen in case of alcohol intoxication. Initially, if you take little amount of peg, you know better than me that there will be cheerfulness, there will be enjoyment, there will be excitement, followed by there will be drowsy, there will be clumsiness, and there may be depression also. So all these symptoms can happen due to huge amount of dissolved nitrogen, particularly in the neuronal membrane. This nitrogen narcosis is also known as, okay, look at here, this is also known as ruptures of the depth or matinee effect. So what is written? It is also known as nitrogen narcosis. Okay, symptoms of nitrogen narcosis is also known as ruptures of depth. Okay, so your joyfulness at the level of depth of water, that is ruptures of depth, ecstasy at the level of depth of water. This is also known as Martini effect because You know the martini, that is that is an alcoholic drink. All of you, I hope you know. So the symptoms of this nitrogen narcosis, it is described in terms of martini. Okay, if you are taking 1 peg of martini, that is equal to the entering into the depth of 15 meter of water. So what will be the symptoms if I enter at the depth of 15 meter at the ocean water, at the sea water? The symptoms will be similar to 1 peg of martini. Similarly, if you are taking 2 peg of martini, the symptoms will be similar to 30 meter depth of sea. Okay, similarly 3 peg is equal to 45 meter and 4 peg is equal to 60 meter depth symptoms, right? So this is known as martini effect or nitrogen narcosis or ruptures of depth. Very, very important question. Okay, so please remember, nitrogen is producing toxicity due to alteration is the ionic composition, ionic conductance of the neuronal membrane, right? So far we came to know that when the person is working at the depth of sea for long duration with the help of scuba, there is huge amount of partial pressure of oxygen, nitrogen, carbon dioxide, and that can produce toxicity if the person is staying there for long duration. Okay, then after that, when the person want to ascend to the surface of the sea water, suppose the person wants to ascend here, there is a protocol that how to ascend. Okay, so there is a protocol that the ascent should be slow. Okay, that the ascent should be slow and it should be in a step-by-step fashion. You ascend a little bit and you stay there, and then you again ascend and then you stay again. This way there is a protocol that how much time you should stay at which level depending on your depth. But by mistake, if the person ascend to the surface of water in a rapid manner, so if there is a rapid ascent on the surface of water, then what will happen? All the gases are dissolved inside your body, particularly the nitrogen, because the nitrogen percentage is very, very high. Now that was in very high pressure, you are suddenly ascending to the surface of water where pressure is only 1 atmospheric pressure. So it will be a sudden decompression of your body from high pressure to the low pressure zone. The phenomena will be similar to opening a cold drink bottle. No, it can be beer can also, but whenever you open up a cold drinks bottle or beer can, what you have seen, there will be bubble formation. So the same way, whenever there is rapid ascent, I can understand that there will be rapid decompression. So this will lead to rapid decompression of your body, right? And whenever there is rapid decompression, there will be formation of bubbles. Bubbles of which gases? There will be bubble formation of the oxygen, there will be bubble formation of the carbon dioxide, there will be bubble formation of the nitrogen. But we are main concerned about nitrogen. Why? Because we have seen that percentage of nitrogen is maximum. So maximum amount of dissolved gas which will form bubble in this condition is the nitrogen. So we are more concerned about nitrogen bubble formation. Okay, bubbles formation. And this nitrogen bubble which is forming inside your body, they will slowly release from fatty tissue, they will slowly release from body water, and they are going to blocks this nitrogen bubble, they are going to blocks capillaries of your body, the small capillaries of your body at certain places. Like for example, they can block the capillaries which are present at the level of bones, at the level of muscles. So capillary at the level of bones and muscles. This is the most common symptoms of this disease condition. The 85 to 90% of the patient will have this blockage of capillaries at the level of bones and muscles. So whenever the capillaries are blocked, obviously there will be severe pain in the joints and muscle. If your joint are paining, if your muscles are paining, what should be the position of the joint? You want to extend that joint? No, there should be flexion of the joint. So the person will bend all the joints of his body, and that's why the disease is also known as BENDS, bends. Okay, so the decompression, sudden decompression sickness is also known as bends because of the bending of the joints in the body due to severe pain. Right. The second most common blockage of these capillaries will be occurring at the level of central nervous system, and central nervous system blockage means there will be CNS symptoms, like for example there may be dizziness, there may be coma also. The 5 to 10% of patient will have this kind of symptoms, right? And very limited percentage of patient will have blockage of capillary at the level of lungs, right? And that is only 2% of patient. Whenever there is blockage of the capillary at the level of lungs, there will be severe respiratory distress. There will be severe respiratory distress, okay? And this condition is known as the chokes, okay? CHOKES. That's why the disease decompression sickness, also known as disease of Bend's, it is also known as the chokes, because the capillary is blocking the pulmonary level, okay? Sorry, the bubbles are blocking the pulmonary capillary, severe respiratory distress will happen, right? So this is known as, okay, decompression sickness, also known as Caisson's disease, CAISSON, Caisson's disease, okay? It is also known as the dysbarism, DYSBARISM. It is also known as dysbarism, or it is also known as decompression sickness. I told you already, decompression sickness, right? So decompression sickness or Caisson's disease or dysbarism is mainly due to nitrogen bubble blocking the capillaries, okay, in different places. There may be symptoms of bones and muscle blockage, there may be symptoms of capillary blockage in the CNS, there may be symptoms of blockage of capillary at the level of lung, right? So if I am using this scuba for long duration, I know that this kind of decompression sickness can happen. So what should be the preventive measure? And if this disease has already happened, suppose one person, okay, already suffering from decompression sickness, so what should be the treatment? Treatment is, again, you put the person inside into decompression chamber. You know that there is a decompression chamber. You have to put this person inside this decompression chamber where high pressure, okay, will be delivered, and the pressure will be released slowly following a particular protocol. Slowly the pressure will be released and the person will be adjusted to the outside pressure. So that is known as decompression tank. Okay, the person has to enter into the tank and slow decompression should be done. That is the treatment. But what should be the prevention? Prevention is that if you can replace this nitrogen, because nitrogen is causing all the problem, okay, that's why there is a particularly gas mixture where nitrogen is completely replaced and helium is used in place of nitrogen, helium along with oxygen mixture. This is known as Heliox, HELIOX, helium oxygen mixture, where nitrogen is absolutely 0%, right? So why helium? Okay, so using helium has certain advantage. What? The first advantage is that the narcosis effect of helium is only 1/5 of the narcotic effect of, okay, narcosis effect is only 1/5 of the narcotic effect of nitrogen. Second, the dissolved helium in the blood, there will be dissolved helium in the blood also, but dissolved amount of helium will be only half of the nitrogen, dissolved nitrogen, right? So dissolved nitrogen, if it is 2 liter, in the same pressure, the helium will be dissolved only 1 liter, half of the dissolved nitrogen. And the narcotic effect of the helium is only 1/5 of the total narcotic effect of nitrogen. And not only that, the third advantage is that helium, it's a very lighter gas. If the gas is very lightweight, what will happen? The resistance at the level of airways, the resistance, okay, during the gas flow or air flow at the level of airways will be very less, so it will be helpful for the breathing at the level of depth of water. That's why we use Heliox mixture rather than using normal air at the level of scuba, right? So this way you have to remember the decompression sickness and how to prevent this decompression sickness. This is all about deep sea diving physiology that you have to remember for your MCQ.